Today we will talk about COVID-19 and monkeypox virus. As the COVID-19 pandemic slogs on, another viral disease has captured the world's attention: pox, formerly called monkeypox. While there are similarities between pox and COVID-19, for example, both are zoonotic diseases, there are distinguishing features with important implications for disease transmission and outbreak dynamics. Source of this information is American Society for Microbiology. Structurally speaking, SARS-CoV-2, the cause of COVID-19, and pox virus, MPV, are very different. SARS-CoV-2, like all coronaviruses, is an enveloped single-stranded RNA virus. MPV is a member of the Poxviridae family. The virus is enveloped, brick-shaped and large, 220 to 450 nanometers long. Its double-stranded DNA genome is encapsulated in a core containing enzymes needed for replication and evasion of host immune defenses. The differences in the genomes of SARS-CoV-2 and MPV have important evolutionary ramifications. There are two known viral clades of MPV, the Congo Basin clade and the less virulent West African clade, which underlies current outbreaks in non-endemic countries. DNA viruses, like MPV, do not mutate as freely as RNA viruses. Pox and COVID-19 are both zoonotic diseases, meaning they are transmitted from animals to humans. SARS-CoV-2 is thought to have originated in bats, potentially hopping to another animal, such as pangolins or minks, before making the leap into humans. MPV is endemic to countries in Central and Western Africa. Although pox was first discovered in monkeys in Congo, they are not the main, or only, reservoir of the virus. Rodents, including rope squirrels and Gambian pouch rats, are believed to be reservoirs of MPV. SARS-CoV-2 is a respiratory virus. It spreads when an infected person breathes out small virus-laden droplets. If someone else inhales these droplets, or they land on their eyes, nose or mouth, the exposed individual can become infected. While MPV can be transmitted through respiratory secretions, it is not a respiratory virus. Rather, it primarily spreads through direct, usually prolonged, contact with mpox rash, scabs or body fluids from someone who is infected. It can also be spread congenitally, or by touching objects and surfaces that have been used by someone with mpox. MPV is transmitted through sexual contact, but scientists are still investigating whether the virus can be transmitted prior to symptom onset. COVID-19 symptoms appear anywhere from 2 to 14 days after exposure to SARS-CoV-2. They can include fever, chills, headache, sore throat, and loss of taste or smell, among others. People usually feel better after a few days to few weeks, though some people have prolonged symptoms that continue up to 3 months. COVID-19 can be fatal. Risk for severe COVID-19 depends on several factors, including variant, vaccination status, age, and whether a person has underlying conditions or is immunocompromised. From pox, it can take up to 3 weeks after exposure to MPV for symptoms to develop. Symptoms may mirror those of COVID-19 during the early stages of infection, like fever, headache, chills. Clinically speaking, pox differs from COVID-19 in that it is characterized by the development of a rash, which can be painful and itchy, and tends to be distributed on the face, extremities, and genitals. Most people recover from pox after 2 to 4 weeks. It can be severe, even fatal, but the mortality rate is nowhere near that of COVID-19. Like COVID-19, pox severity also depends on age. Young children are more likely to develop severe disease, and the presence of underlying conditions. Due to rapid antigen tests, people can test themselves for COVID-19 at home. Nucleic acid amplification testing, NAAT, such as polymerase chain reaction, PCR, is also available. Currently, there are fewer options for diagnosing pox. Confirmatory testing is only conducted via PCR on fluid from pustules or dry crust from scabbed lesions. There were no vaccines for COVID-19 at the beginning of the pandemic because SARS-CoV-2 was a novel virus when it was discovered in late 2019. Now, 4 vaccines have been approved for use in the U.S. COVID-19 vaccination, even for people 6 months of age and older. CDC recommends that individuals consult with their healthcare provider to determine which vaccine is best for them. Mpox vaccination efforts are currently focused on people who have been exposed to mpox or who are more likely to get mpox. For one, SARS-CoV-2 was a novel virus when it emerged in late 2019, meaning it had never been seen before. As a result, the world didn't have vaccines or immunity to the virus, which allowed it to spread like wildfire. Monkeypox is not a new disease. Scientists know more about monkeypox than they did about COVID at the beginning of the COVID-19 pandemic. Vaccines are also already available and, while there have been supply chain challenges, are being administered to at-risk communities. As such, the world must remain vigilant and put the lessons learned from the COVID-19 pandemic to good use. If this video was helpful for you, then please do subscribe our channel. Thank you.